I have another hypothesis to throw in to this discussion as well, Bret, which you may have seen on my Twitter. I keep mentioning something called the psychopathic determinants of health. So if we go further upstream, because what we're trying to understand also is a culture. This is, if the medical profession aren't dealing with this in the way that they should, if we're still trying to mandate, coerce kids to have the vaccine when we're talking about it being suspended for everybody, how does one explain that? And my hypothesis, which I think is based upon evidence, is at the root of the problem, if you go upstream, is that we have very big, powerful corporations, in this case, Big Pharma, who have had increasing power over medical decision-making over probably the last couple of decades. And everything really starts from their behavior. So the entity that is the big corporation is there predominantly, and I think it's really important to have this very explicit discussion with people. I tell it to my patients. I say they are there. They have a legal or fiduciary obligation to produce profit for shareholders, not to give you the best treatment. But the real scandal is that those who have a duty to patients and scientific integrity, doctors, medical institutions, academic journals, collude with industry for financial gain. But the way that the pharmaceutical industry operates has been described, not by me, by a leader in his field, forensic psychologist Dr. Robert Hare. He actually documents that the entity, not the individuals within them, we're not pointing fingers at CEOs of companies or anything like that, but the way that the drug industry operates is essentially akin to a psychopath. You can compare it to psychopathic behavior. So callous disconcern for the feelings of others, deceiving people for profit. These are typical behaviors that there's a track record. Of course, one great example, I know we mentioned it before we started the podcast, is around Vioxx and what happened there. And actually, if you look back and you understand that Merck knew, those scientists, internal scientists knew that it was going to cause an increase in heart attacks, but it didn't bother them from the company perspective because they knew they were going to make a lot of money. So, the only way to describe this type of behavior, in my view, is psychopathic. So actually, I think, maybe we need to change the narrative in terms of explaining the culture in what's going on in health right now as being a downstream effect of an entity that behaves, that is anti-human, that is anti-democratic, that suppresses free speech, that suppresses freedom of information. And we can apply all of that to what's happened during the rollout of the COVID vaccine, which I elaborate on in my paper.
Yeah, I resonate with a lot of that. And in some sense, we've landed in my area of specialty. As an evolutionary biologist, I can tell you exactly what happened, which is our system of laws surrounding corporate behavior is basically a niche. It describes a niche. And what has happened is that any corporation that didn't start out psychopathic has evolved into an effectively psychopathic entity because it couldn't compete otherwise. And so it really shouldn't be any surprise to us at all that this is the kind of behavior. The shocking indifference is our failure as human beings. We over-extrapolate our own internal experience and we project it onto these corporations because, of course, when we encounter them in a human form that's describing what they're doing. But, of course, they're psychopaths, right? If they weren't, they would have failed in business, so they evolved into them. And this does explain not only, Vioxx, but a basically general systematic enlarging of loopholes. I mean, effectively, you've got an industry that plays a particular game. I call it the pharma game. And you tell me if this matches your understanding. But the pharma game involves owning various pieces of intellectual property, finding conditions to which one of these pieces of intellectual property can be plausibly linked, broadening the diagnosable characteristics so that the maximum number of people are thought to have the condition, applying these pieces of intellectual property, essentially pharmaceuticals, compounds or treatments that are highly profitable, and then ignoring or systematically obscuring any harms that might emerge as a result. I mean, that's the winning strategy. And one of my, it's very easy to imagine all sorts of conspiratorial things happening in the case of COVID. The harms are so shocking that one, struggles to imagine what the conversations inside of pharma sounded like. But the shallow end of the pool sounds like this. Pharma has captured our governmental structures. It corrupts them 365 days a year as a matter of simply doing business. And when COVID arrived, there was no mechanism for recognizing it as anything different than a huge business opportunity. So it steered us in this direction because it's doing that all the time over hundreds of different compounds and conditions. That's just simply what it does. That's what it is.
Absolutely. I think that's summed up very, very well. That's exactly what they do. Their incentive. I debated at the Cambridge Union a few years ago, the CEO of AstraZeneca, and the motion that was put forward is that we need more people taking more drugs. That was obviously the motion put forward by them, and I opposed it. And of course, that would be the ideal scenario for them, to get as many people as possible on as many drugs as possible and exploit the legal entity that they function under to be able to do that. And I think if we're going to combat this as well, ultimately, Bret, it needs changes in the law. These laws themselves that allow them to do this are clearly not democratic. They're not just, they're not ethical. And therefore, what we need is really citizens to become aware. And of course, one of the ways of disseminating such information is through mainstream media, and then it puts pressure on politicians. But to paraphrase Noam Chomsky, the doctors and patients don't know what's happening, and they don't even know that they don't know. So the reason I mentioned that, I'll give you an example of ignorance of this problem, these structural failures at the very highest level. A couple of months ago, I gave a talk at one of the meetings organized during the conference of the British Medical Association. I had very senior medical establishment figures there, the chairman of the British Medical Association, the president of the British Medical Association. And in that talk, I talked about the corporate capture of medicine and public health. That was essentially the talk title. And during the talk, I mentioned failure of the regulator to do its job properly. And I said that the MHRA in our country, the Medical Health and Regulatory Agency, receives most of its funding, 86%, from the pharmaceutical industry. The chairman of the BMA didn't believe it. He was gobsmacked. He looked around and said, "Is this true?" And of course, ignorance of these structural failures are even at the very highest level. Rochelle Walensky, you may remember her commenting about the fact that her optimism from the vaccine came from a CNN news report. So the media has a huge role to play. And I know from Paul Thacker, investigative journalist, he did a blog on this, that original CNN news report, which reported on the so-called efficacy of the vaccine, was almost verbatim a reproduction of Pfizer's press release. You really couldn't make it up, Bret. You really couldn't make it up. So I think the understanding and acceptance of these entities and how they function is one thing. But I think what people need to realize is that the regulators themselves, the people that are supposed to be filtering this information and, protecting the public from the so-called excesses and manipulations of industry, are actually themselves captured by industry. Universities, certainly in this country, over the last 20 to 30 years, have more and more funding from the drug industry. Most of their funding for research comes from the drug industry now. Universities are supposed to be guardians of the truth and represent the moral conscience of society. But how can they represent the moral conscience of society when they are being influenced and controlled by an immoral entity? What's going to happen? It doesn't take a rocket scientist to figure out that's going to have a hugely negative impact on society.
Yeah, there's, trying to do anything about it without changing the law is a little bit like taking the water in your glass and trying to shove it over to one side. And the answer is no, it's going to fill the glass. That's what it does. And we've got a niche, and these entities are going to operate within that niche and become adapted to it. The only solution involves changing the niche. Now, of course, that is almost impossible to do because, frankly, buying political influence in the West is inexpensive when you're making the kind of money that they're making. It's just the cost of doing business. And so, my hope is that the horror of what we've done surrounding COVID would wake people up, would embarrass them into having to change laws, even though there was a financial incentive for not doing it. But so far, I have not seen evidence of that.
Yeah, Brett, I agree with you. I think in some ways we have to use this crisis and turn it into an opportunity for good. And I think I'm with you. I think this will be the tipping point. I think we're not far off the bubble bursting, Brett. To be honest, I think more and more people are becoming aware, and the more that do, they become advocates for the movement to say this is not acceptable, and we are angry about this, and we are going to hold people accountable for this. And that movement is growing every day, Brett, and it will reach a tipping point, I've no doubt. But we, obviously, as advocates for the truth, we can't be complacent. We need to keep making noise. And of course, even this conversation, I'm sure in itself will have its own ripple effect in helping that change happen.
It will. I will point to, obviously, this is one of the messages of your terrible story. But the fact of the injuries from these therapies being so common means that many people are going to be touched quite directly. This is not an abstract question for an increasing number of people. I will say that even in my friend group, I know off the top of my head 2 other stories where people that I know well enough to have shared a meal with them have lost fathers. Do I know for certain that this is what happened? I don't, but the pattern is awfully clear. And, that's before we get to the many very serious but lesser adverse events, of which I could list off a couple dozen. It's shocking how many people are seeing the evidence in real time, right in front of them in their own families and friend groups. So that will have a profound effect.